But good evening and welcome to the School of Architecture and Planning. As many of you know, just recently, we were accepted as an institutional member to the AIA Design and Health Research Consortium, which is a very prestigious network of public health public health experts and architecture, as well as national organizations like AIA, ACSA, Architects Foundation, and the Association of Schools and Programs of Public Health. So we are indeed honored to be part of this network, thanks to the hard work of Dr. Gharipour and our friends from the School of Community Health and Policy. This is our first, I would say, formal event as a consortium member. But we expect more of these events as well as tangible outcomes in the near future. So I'll just let you know about the School of Architecture and Planning. We have a strong track record of engaging in not only interdisciplinary research, but transdisciplinary research, or collaboration work that give our students the opportunity to try new things, to push boundaries, to be uncomfortable. Students will like you to be uncomfortable. So especially the evolving area of design and health, we would like you students to really seriously take a view of where you can contribute to this evolving area. We have collaborated with neurobiologists, physicians, nurses, social workers, and other professionals. We have also collaborated with environmental engineers, NASA scientists, and other disciplines. So again, we are big on transdisciplinary work. So as a school, we are addressing the built environment at various scales and contexts. We study the room, the building, the garden, the site, an urban block, connected greenways, the neighborhood, the city, and the region. So that's what we are about. And we are acutely aware that the design, planning, and construction disciplines have the power to influence people's quality of life, and we take this mission seriously. But we also understand that in order for us to make a difference and to be heard, we have to engage and understand the importance of evidence-based research and pedagogy. So we are infusing more rigorous research methods in our curricula to prepare our students to be more competitive. We're also committed to supporting them at conferences where they can present their work and meet new people. We continually push them to explore the intersection of design and health. So today we celebrate and mark our foray into the Design and Health Consortium, and we are up to the challenge and we are ready to work. So thank you and have a great evening.
I would like to welcome all of you again to this event. Our first speaker is Rolf Haarstad, who is a principal with HGA Architects and Engineers. He has led the design and delivery of several major healthcare projects throughout the Mid-Atlantic region. He is appointed as the future chairman of the board of directors at Western Maryland Health System.
Thank you, Mohammad. I practiced this yesterday with my BD. She's very rigorous. I got it at 20 minutes, so no questions, okay? I have a pretty ambitious agenda. What I want to do is talk a bit about technological evolution, human evolution, healthcare reform as a product of that, and then all innovation that's being driven really by healthcare reform right now. And there's a lot of lay people here, so I don't want to go off on jargon tangents. I'll try to be as clear as I can. But I think it's a tie between healthcare and architecture on jargon. I'll just tell you that right now. I call this entropy in the exploding hospital. The reason being, where am I pointing this at? Okay. There we go. I think what you'll see in several examples today is a system, a healthcare system that has evolved from a cohesive, highly ordered, very centralized system into something that's more spread out now. I wouldn't call it necessarily disordered, I would call it more dispersed in a sense. But as an entropy, maybe a piece of ice going to water, all the properties are still there. They're just being done in a different way. And you're gonna see how that's happening now across the continuum. So let's start a bit with technological evolution. This is all great, right? Every era moves into, from bronze to iron. We're currently now in the information age, moving into the biotech age, which I'll talk more about. But this is all good, right? This is progress. But there's an insidious nature to progress. Every time we make that sort of leap as a human being, it removes one more layer of our participation in the world through physical activity. I'd say maybe the fourth dude on this, he's probably still burning an extra 2,000 calories a day just living, right? Whereas now, and some of you might remember the movie WALL-E, where it got to the point where there was no physical activity whatsoever, so they actually had floating chairs that they would sit in. Now, you see, a great majority of us are very sedentary in our lives right now, like the gentleman right before the end there. And did you think of your grandparents joining a gym? They never did that. And these days, you got anything you can do to try to burn an extra 500 calories a day, for God's sakes. So, all right, so let's throw some money at that. That's gonna fix it, right? Here you see over a 50-year period, the expenses on healthcare in this country as a share of the gross domestic product. Well, that must be fixing it, right? We've increased just exponentially the amount of money that we're spending on healthcare, but hardly at all. Here in this diagram, you see that, and this is something some of you might have heard, 5% of our total population takes 45% of the expenditures in the country in terms of healthcare. That's a very sick population. And even across the board, I was at a lecture last week, less than 3% of the country actually has these four characteristics. Doesn't smoke, wears their seatbelt, eats fruit and vegetables, and exercises 3 times a week. Less than 3% of the country, right? So we are not that well of a country going forward. So you hit a wall, right? It's time for a different look at this. So, we talk a lot about the paradigm shift. This slide here represents, I think, the paradigm shift that American healthcare is going through right now. We forever have been a volume business. And think about that. Why would you incentivize sick people? Why would you incentivize an organization to put people in beds and that's how they make their money? What we're moving to is a value proposition now. We're going to start reimbursing hospitals based on the outcomes they have, on the patient experience they have, on the personalization of that care. It's moving away from that volume to a value network right now. Some jargon. I'm going to talk about inpatient and outpatient. Very simply, inpatient is when you're in the hospital and you have to spend the night, right? So your overnight, maybe your length of stay is 3-4 days. Outpatient, you are not staying overnight in the hospital. What you're seeing right now is a trend, and this is a typical hospital. And a shout out to some of my folks here who actually worked on this with me. This is Western Maryland. We'll be taking over as chairman this summer there. This is, for all intents and purposes, what probably most of you think of as a hospital. It's a collected plant of rooms, diagnostics and treatment. There's cancer care involved here. There's actually rehab. There's internal outpatient in this one. But it's all in one place, one spot. But what's happening now, and you'll hear this buzzword a lot, we're getting into the whole realm of population health. So my clients out here that now are responsible for not only the outcomes of maybe the patients they've been taking care of to date, they're also now responsible for their constituency in an entire region, so primary and secondary, sometimes even their tertiary, where they're coming from. So what you're seeing, and think back to that symbol of entropy. At the top, let's say that's Western Maryland. Well, their continuum of care involves all these different places where you will come into the system. So we call everything to the right our pre-acute, and everything after that post-acute, and actually my good friend Jane will be talking about some of her post-acute care work after this. But all of this comes together where our clients are responsible for this whole continuum of care across the board. So what does that mean then in terms of where the trends are going? Well, as I talked about, the population trends, the raising level of sickness with very sick people, but also the cost of that care is driving us to having an actual decrease in inpatient stay and an increase in outpatient growth. And that forecast right there is really driving a lot of the innovation in healthcare architecture right now. This is interesting. So I did a search on MedStar locations. That's all the MedStar locations. You start thinking about a continuum of care and you get outside of the acute care hospital, every single one of those pins is a MedStar location, whether it's a clinic, some offices, one of their hospitals, etc. But you just do a click on that and you see how pervasive this community health, population health is becoming. So what is it? So it's leading to new building types, right? So this is one of our projects in California. This is for all intents and purposes what we call a hospital without beds. So it's got a primary care facilities, nutrition, there's some diagnostics and radiology in this, but it's not what one would typically perceive as a healthcare building, okay? This is another trend we're seeing quite a bit of. This is a project we're doing right now for Pinnacle Health up in Harrisburg. What's really interesting about these retail conversions, and you'll see a lot of these, is we're piggybacking on the work that the retail community did. They're geniuses on retail, right? So they know where the populations exist, they know, and they always have parking, right? So, you take over these old retail centers. This one we're converting to a primary care with an urgent care center in it. But you've got all the parking you need, and somebody already did the retail analytics that told you that your whole demographic's already going to be coming to you. So it's pretty cool. This is a healthcare facility. Doesn't look like one, but this is a wellness center for Virtua Health up in New Jersey, another of our clients. This is part of their property. This is part of their portfolio. But it's a high-end health club, right? So as we try to affect the population in terms of not getting them into that acute care environment, but actually really concentrating on their health and wellness, we're having whole new building types coming in for us as architects, as healthcare architects. Specialty hospitals. This is a cancer care center, or cancer hospital, and actually an inpatient hospital we did as a competition out of my studio for Algeria. This particular project would have had a geriatric wing, adult wing, and a pediatric wing, all under one house, but just purely for cancer care. So you're seeing a lot of this too, specialty hospitals focusing on one delivery. Also then you get into that post-acute care world, long-term care, skilled nursing. I would say, and Jane, I think she might agree with me, that for the longest time, healthcare architects have sort of stayed out of the post-acute care world. And rightly or wrongly, it's now certainly in our purview only because of the fact that every single one of our clients is responsible for that entire continuum that we talked about. So we want to bring the same sort of sensibilities that we bring to our larger healthcare work, our inpatient, et cetera, now into these communities for the elderly, for rehab, et cetera. The key is to take care of them as well as we can here so they don't go back to the hospital. That's the big key. Other innovations you see now because of this exploding hospital are the clinics that are showing up in your everyday retail experiences. I pick out Target because I'm sort of partial to their design. I think they have a pretty good handle on design. But it makes total sense, right? For something for a flu shot or something that you just need to go in and have maybe a 10-minute consultation, why not just stop in when you're doing your other things, right? So you're seeing healthcare become a very personalized delivery approach. This project I show you because not so much for the room, but just for the bed. And this was a project we did for Kaiser Permanente. It was their large hospital, or small hospital, big idea competition. That is an LSTAT bed, and for those of you who don't know what an LSTAT bed is, it's been developed by the military, and it's a bed that within the technology of the bed handles trauma, treatment, etc. It has all the med gases embedded in it. It can take your weight. It can take your vitals. So what does that do? That frees your room up so you have no med gases in the room or on the wall. You have none of those beeping and, it's a home environment, right? So by taking the technology down to that most personal level you can, we are really freeing up this actual spaces we're building to be more inviting, more family friendly, et cetera. Again, I've worked with some folks here on this one. This was a mobile hospital solution that we had actually intended to develop for Morocco. Now, the real innovation in this is not so much that it was being delivered in these trailers, but it was in the architecture that we brought to the trailers themselves. So if you look at the diagram below where you see the black trailer, and I'm sorry it's a little light, but what we developed as a team was a way to connect these trailers on both sides. And so what that did was allowed us to create actual racetrack circulation, which you can never do in these sort of situations. So we were able to develop a 50-bed hospital that's floor plate essentially acted as like a regular stick-built hospital. My same team, Pavlina was on this team, and Kapow and Jesus back in the day. This project came out of when we were working on Western Maryland, and we quite literally said to ourselves, what are we doing? I mean, there's so much that's being repeated in this building. How can we get a handle on what could be modularized in this? And so, as a group, this was really more of just a test project for us internally, but we developed this mainframe solution with this plug-and-play approach. And then we went through our program for the main hospital, and we broke it down into the modules. Okay, so an office equals 1, a conference room equals 2, an OR equals 4, and so you see that as you're going along the bottom there. So how do you find those modules? And we even took us as far to develop modular facades. So it's very diagrammatic to the right, but the idea here is that no matter where you take the solution, we can create an external envelope that responds to the context that it's going to. Now, again, healthcare is getting much more personal and much more social. It really is coming into the social realm right now. The idea that you can get your x-rays on your iPhone at home, you can see how long it's going to take to wait at a waiting room nearby by just bringing it up. Yelp is rating doctors, that kind of stuff. I mean, everything's becoming very consumer-centric right now, and it's to put the control into your hands in terms of how you want to use healthcare right now. Just the personalization of healthcare is probably the biggest thing that's going on right now. And the ability to stay at home and maybe take care of yourself. Nobody wants to go to the hospital. You get sick at hospitals. I'm telling you, being at home, your outcomes are going to be all that much better. But it's the technology right now is allowing us to do so many different things. Wearable technologies. So this diagram is I like this one because they did it. I can't remember who they were surveying, but they asked them if you had healthcare technology on your body, where would you want it? And so 29% were okay with clipping it onto their clothing and maybe having it on their wrist. I like the 3% that wanted tattoos, right? That's pretty cool. But what's happening right now is the technology exists to create almost an entire diagnostics department on your body with the clothes you wear and with what's happening in, which I'll end here with as we get into the biotech area. one of the big thresholds in biotech and the medicine coming from that was doing the full DNA workup, and it used to be just exponentially expensive. But it's under $1,000 now, and I think it's even less. Any one of you now can get your full DNA workup, right? And it's yours, it's only yours. So what does that mean going forward? It means that cancer care, for instance, instead of testing drugs on your mother, and maybe this one will work or it won't, you take her full DNA workup and those customized medicine to her DNA. So for her, it's for nobody else. They'll customize it for the next person the next time they get the next DNA workup. So what does this mean for architecture? I think as you saw with the LSTAT bed, I think as healthcare becomes more personal and more dispersed, it's going to become more neutral. And I think what you're going to see is you're going to see the high tech coming close to your body, and you're going to have regular spaces to do it in. You're still going to have very sick population, and I think the hospitals are just going to turn into huge ICUs, intensive care units, because they're always going to be that sickness. But for the regular day-to-day care, you're probably going to do it in your den. And I may be running out of buildings to do, so I'll probably do a lot of wellness buildings, or probably something like that. So that's mine. Thank you.
Thank you, Rolf. Our second speaker is Jane Rohde, who is a national leader of senior living research. She champions a global cultural shift in senior living through her consulting, research, and advocacy. In 2015, she received the first Changemaker Award for Environments for Aging from the Center for Public Health Design, which is an extremely prestigious award.
Hello, everyone. Good evening, good afternoon. Good to see everyone. I'm really excited because Rolf and I have done some work together, and it's great because he set me up perfect. So thank you for that. So not only do people not want to be in acute care settings, they definitely, when was the last time you said, hey, let's go visit the nursing home? You know, not so much, right? Not usually the idea of it behind where people want to go. So we're going to start out with, warning, warning, old people. Okay, this is the sign that's outside of every elder facility and care facility in England. Really? No, this is not acceptable, right? So I show this because people, this is really what people think of, I've watched people think of it from an ageism perspective, where I see them talking about environments for older people, and I'm like, okay, so you just made them out as this frail little person who has to do whatever. Well, I can tell you, I know a lot of seniors that are really spunky, including a lot of my own family members, that not only are they not going to facilities, but they do whatever they want to do. I don't know about you guys, have you done with aging parents yet? Oh, just wait. Just wait. So, the reality, this could be your caregiver. Okay, so every once in a while, you got to kind of take that reality check and go, who is going to be out there as our caregiver? We don't have enough caregivers. We don't have enough folks that are interested in senior living. I'm hoping to change that a little bit because I think it's such an exciting industry. And I think mostly, what do you think of? Stinky, old, skilled nursing center, bad lighting, and people screaming. Pretty much it? Yeah, I got a lot of shakes of the head. It does not have to be that way. It shouldn't be that way. And there's a lot of things that we can do to make it different. And it needs to be different. Not so sure about that. Although, I don't know, it could be an interesting conversation piece. Someone with dementia might have a little trouble. So how are we looking at senior living differently? This is a model that I love because it's called Generations of Hope, partially because it used the word hope. But the good part about this is it is mixing generations. We have isolated seniors far too long. So what happens if you start utilizing those different vulnerable populations as an actual resource, okay? So this community is in DC, just opened about 6 months ago. And it's a small apartment building. Independent living is what we would call it. But Generations of Hope model takes a vulnerable population, surrounds that with a group of volunteer elders who live in a community purposefully. They decide to move there, agree to volunteer X number of hours as part of their rent and a part of their lifestyle. And you can either have the vulnerable population spend time or not spend time in terms of volunteer. It depends on the population. In this case, it was young women aging out of foster care with one child and a group of seniors that wanted to help. So that group of seniors there are very diverse, and each has their own issues. One gentleman has glaucoma and his issues, sight issues. We reviewed his apartment to figure out what else we could do just to make it easier and better for him with light levels. The woman that was in the wheelchair, I walked into her apartment, we were talking, and there was a young woman in there, and she had her scrubs on. And I thought she was her attendant. And she goes, oh, no, she lives here. She just came by because my physical therapist is coming by later, and that's what she's taking in school. So now she has a live living model, right? So what does that mean? What is senior living? It is creating community. That's what we've been missing, right? Again, when was the last time you said, hey, let's stop at the nursing home? Unless you're me with my husband on vacation. But, so there are some people who have that quirk. The woman in the foreground, she had a son who had Down syndrome, and she moved into the community as well. Miss Jessie is the lady in the striped sweater in the background, and Miss Jessie had me look at her, it won't shine on there, I think. She had me come into her apartment, and come to find out, she was afraid she'd break the shower head if she turned it around, but during construction, it had gotten turned back around toward the wall. And I go, oh, and I cranked it back down, and she goes, oh, and I go, that was really the shower problem? She goes, yeah, for the most part. She didn't even know to ask somebody, right? So you have those kinds of things in that kind of moment where the design needs to reflect what people need. So when we did all the programming for this, the functional program it was the first time that the Department of Aging and the Department of Child Welfare Services in DC had ever been in the same room together, ever, okay? Think of the commonalities, think of the energy, think of what you could put together to create community out of that. This is Bastian, this is Matthew. He was the only young soldier to survive his entire unit in Iraq, okay? So when they come out, and they have a lot of veterans have traumatic brain injury, and they have some fairly good programs that they go through. There's one at the VA in Richmond, and we went to see the folks and the doctors, and we were talking to them, and they have step-down units. So you come in as a veteran, traumatic brain injury, diagnosis, you go into polytrauma. From polytrauma, you go into your activities of daily living, so that you get used to doing those, most of you won't know that activities of daily living would be like bathing, eating, learning kind of how to get your life back together. And then they go into IADLs, which are instrumentals. So it's things like looking for a job, getting ready to be able to handle money again, a housing situation. But what next? Nothing. I said to the doctor, I go, so it's kind of a gap. He goes, no, it's not a gap, Jane, it's a cliff. It's a cliff. So how do we provide community? So a young man named Dylan Tett decided he was going to use the vulnerable population as the wounded warriors, and that seniors and both civilians as well as retired military would become that surround group, right? And so he's developing a community near one of the canal breaches that was in New Orleans. Dylan himself has post-traumatic stress disorder. He came back from Iraq to Katrina, right? His wife was teaching school in a Pizza Hut in Lafayette, okay? So they're getting ready to break ground. He's done a tremendous job. This is the site that we've been looking at. This is Matthew and his mom, Lisa. Lisa would say to me, so what happens to him when I go? He doesn't live with her now, but he can call her and go, I can't find my spoon. He's got a special spoon that he uses because of his abilities. And so his frustration level comes up high. If he was living in a community, a supportive community, you ask your neighbor, people know you, you start to develop that, and they want purpose. People don't want to be caged away and said, oh, you're not worth anything anymore. This is giving people a sense of purpose, something to do, something to volunteer for. Everyone in this community volunteers, no matter if they're a child, a family, a veteran, an elder, everybody volunteers. That's the program, that's the basis. So they're going to be doing housing as well as some services. So the interesting part is it's like you have to have some staff, but it's not overwhelmingly the staff, it's actually the community itself that becomes the intervention, which is really exciting. So when you look at how you think about senior living, We look at it using this social cultural context. This is a senior living guide that we developed a few years ago. And it talks about instead of looking at the physical environment first, look at the resident desired outcomes, look at the organization mission and values, take that information with the operations and every functional detail that goes into it. I can't tell you how many healthcare settings I go into that do not function. They do not function at all. They do not work. They don't allow the staff to do what they need to do. They limit independence of a resident, right? Not intentionally necessarily, but not understanding operations is usually key in that. And we find that the physical setting could support those other pieces, that you get a continual improvement process that you can actually develop. If you look at the outcomes of each one of those and you keep updating them as you go through, you get a continuous improvement process. And that's what we're really missing a lot of. So that's where a lot of the evidence-based design work that we all do and can be applied comes into being and being utilized in the programming process. I love this project. This isn't one of our projects, but it's Abe's Garden at Park Manor. They designed it so that it was a living model, so that you could basically do research on a continual basis for not only improving the outcomes of all the residents that live there, but every other facility that's ever designed after the fact would be able to use their research as a database, right? That was one of their initial evidence-based design principles for them to start the project, was to actually have it be a living model. What if every one of us designed a building that was a living model that we could reuse that information over and over again to help everyone else improve the outcomes? Fantastic, right? Right?
Yes.
Yes, thank you. So this is their art room, and this is one of my favorite pictures because when I show this, people will go, "Really? That's senior living? I could live there." And that's the reaction you want. You want to be able to know that you could live there. And so this idea of measuring, and a lot of attention was paid to lighting, circadian rhythms, the evaluation of how nighttime, daytime light impacts folks with dementia, resetting the circadian rhythm, the vitamin D and the lack of vitamin D, and making sure that they have access to it. So it's a beautiful project. Take a look at it. It's got great evidence information, and then there's a whole nother website, not just with the architectural information, but also with the design, and it's a LEED certified project. This is our project in China. I've been working on this project for 7 years. And think about it as though you were reinventing, or not even reinventing, but inventing an entire new industry. Senior living doesn't exist in China. So it's like taking it from scratch. So when you have American developers that kind of plop over there and go, "Hey, we're going to do this," boom, and they label it like we label it. Why are our labels here? Our labels are only here because of regulation and how we're reimbursed. There's no reason why we would call it skilled nursing or anything else like that. Actually, it has really bad connotations in Chinese. I won't share that. But on the flip side of it, you have residential aged care, is what they call it in New Zealand and Australia. So it's very interesting to them. They love that terminology. So we've broken this down into households, which means if you could take your home and you could create an extended care area that you were going to live in that was going to provide services to you, but it was much of home and symbolized and felt as much like home as possible, that's a success point, okay? That's what you're really looking for when you're looking for innovation in senior living. So this is the project, and I got to tell you, for China, for a rendering to be that close to the real building is a challenge. I mean, that's not an accident, you know? I mean, that's a really hard thing to do. Outdoor spaces. All of the resident rooms have to face south because of feng shui principles, and you have to be able to get 20 minutes of daylight into it on the shortest day of the year. Also not an easy task. The site was somewhat square, and it really needed to be rectangular, because if you think of it, it's all single-loaded corridors instead of double-loaded corridors. So we have this whole different way of thinking and looking. So I call it China-fied. So you basically take where you might do in a Western model, and then continue it on its innovation path into what would it look like in China if you were going to do it in China for Chinese people. What do they want? They think completely different than US. And so that has been part of it. They also have no caregivers. They have no geriatricians. They have nothing in basically the palette that we would choose from and pull from in the US. They don't have that there. This is the side of the building, and we have outdoor spaces on every floor. And that's the exterior in the back. We have garden spaces that, just to knock your socks off, because it's just outdoor space for Chinese people, are so integral to everyday life. You don't go anywhere where you don't look out the window in the morning and there's not a Tai Chi group or the flash mob stuff where they do the dancing stuff and all that kind of stuff. It just happens everywhere. It's instantaneous. So having access to all those different things. They have reflexology stones that are raised stones that they walk on in their bare feet, and they're always laughing, holding shoes, and I'm thinking, yeah, not in the US. Can you imagine you're like, oh, let's put raised stones in the Alzheimer's section. Yeah, probably not. Probably not. So this is Mr. and Mrs. Biggs. So it's true, the longer you live together, the more you look like one another. I'm totally convinced. So Mr. and Mrs. Biggs live in a community down in Leonardtown. And it seems to me that in most traditional settings, people, when they have wandering issues or they have some dementia issues, they're basically put away, right? Let's move them to a higher level of care, blah, blah, blah. Well, what if you thought of it differently? Folks who have developmental disabilities, we stopped shutting them up, right? We started mainstreaming people. Why can't people with lower levels of dementia actually be mainstreamed? Why isn't that? There's no reason why they can't be. Between the medications we have and the different technologies that we have, there's no reason. So this couple, they discussed it. They had a care plan. They had like a little eruption. He got lost and had some problems. He used to walk into Leonardtown, quite a distance from the home. And they had a meeting, and they decided to just move their apartment within their own home. So they just changed apartment locations. They were able to do a couple of things to allow them to extend their life as long as possible. That's the part of it. And we don't really call it aging in place so much because that's like aging in place. Does anyone really want to age in place? No, we want to like design and longevity, right? It's got to be like cool words, right? You got to use cool words for that, not other kinds of words. So spaces like this is a household model, but it's adult daycare. So if you have someone like Mr. Biggs who has a problem, and you know that he really wants to still live at home with his wife, just like he always has been, there's no reason why he can't go to adult daycare and be able to participate in activities during the day, give her a little bit of respite, and still be high functioning. We want to be as high functioning and allow that as much as absolutely humanly possible. So how do we get there? Part of how we get there is our regulatory system sucks. So how do we work on the regulatory system, right? So we've developed this new guideline through the Facility Guidelines Institute, hospitals and outpatient facilities, as well as residential health care. The picture of the guy said, could be your caregiver. They used to call us other, the largest demographic shift we will ever have in our entire lifetime, and they called it other, right? Well, that had to change. So now we're our own book. So basically we have guidelines now that help people to be able to make innovation happen. It used to be that you look at the guidelines, the licensing guidelines, what would it tell you? How to do things institutionally, right? So in order to prevent that from happening institutionally, what do? You actually be able to give them guidance of how to change and make it more innovational. And so in the hospital and outpatient book does similar things in terms of that. Rolf is so right, the hospital is getting smaller and smaller and smaller. Outpatient is growing, huge, and it's all going to happen at home. No matter how we look at it, it's all going to be happening at home. And so how do you create those types of support facilities? Everything from hospice care to the Generations of Hope model to any other kind of services, technology is allowing us to do that. So it's moving it all into that direction. And for the next round of the 2018 guidelines, it's going to be hospitals as separate, outpatient facilities separate. And part of that's because of the person-centered medical home model and these clinics and the importance of outpatient. So now we have three separate books for the facility guidelines. So this is my mom and dad. They just celebrated 54 years of marriage, and we're pleased as punch about that. And thank you very much.
Our next speaker is Steve Kelly, who has over 20 years of experience in landscape architectural design with a focus on design for healthcare. Steve's healthcare experience includes hospital master planning, healing gardens, cancer center infusion gardens, prayer gardens, dementia gardens, and site amenities.
So several years ago, an architect that I was working with said, I see you guys as the pretty picture guys. And I was kind of offended at the time. But as I realized, as I looked at these other presentations, I just have pretty pictures. So I probably really am the pretty picture guy tonight. One of the things that we're talking about with healing gardens is that how important they are in healthcare and what that actually does for healing. And we've discovered that people who have access to green space, either physically or visually, not only heal faster, but they require fewer medications, they require less time to heal. There are lots of benefits from having access to green space. And we think there are a lot of ways that you can do that, and how can you design green space so that it's the most effective. One of the things that we like to do is maximize green space and try to provide an away experience. And there are lots of ways that this can be done, and something that people don't realize is that a lot of hospitals didn't really have green space until recently. And so they're trying to find green space in places that they didn't really have it before. This Anne Arundel Medical Center, this little garden green space is probably 30 feet by 40 feet. It's a really small space, but it provides a space for people to get out into and enjoy nature. This other one on the right side was actually a parking lot, and they carved out a piece of the parking lot right next to the building to provide a green space because they understood the importance of having green space. This is the NIH Children's Garden, and it's really great because this is a hospital garden that allows kids to get out and feel like they're at home. They can actually be away from the experience. It's the kids who are visiting their siblings, or those who are even here well enough to get outside, have an opportunity to see these colorful spaces and make them feel like they're really not in a hospital environment. And so these bright colors, there's even a tree house that these kids can play in. It's really a great experience for kids to get out and get away while they're healing. One of the other things that we're thinking about is, are there ways that we can use green space that's available to us and must be available according to regulations that we can actually use in a positive way? This is actually not a healthcare facility, but it's an example of a stormwater management facility in Baltimore. And it doesn't look like it. When you look at this, it looks like a place to sit down in a park and enjoy. And I think that there are lots of opportunities to think of how can we rethink about how we use green space so that it actually becomes not only a necessary function for cleaning water and storing water, but also a landscape that we can enjoy. We did this at Kaiser Permanente in Largo. The site was somewhat limited by the time you put the building in, and the stormwater facility ended up being right in the middle of these buildings. So we just crossed it. You're actually walking across the stormwater facility. It looks great. It's a landscape. People go out there, they walk down, they sit, and they enjoy it. And it's something that everybody considers to be their healing garden, even though it's technically mostly cleaning water. And this is, every time I've been there, there's been people out there enjoying it, sitting there. And it's not only a place that everybody sees on the way into the hospital, but it gives you that sense of green from the rooms, but also as you're entering, everybody sees it on their way. Another important thing is, how do we think about green as a visual resource? Just being able to see green is as important as being able to get out there into it. And many people are not able to go out there and get into it because they're not well enough. So having that view from your window is actually key. And then also having a view from a waiting room. If you're there waiting for a while and having the opportunity to look out into green space, it's kind of nice. And we also use those green spaces even as wayfinding devices. A lot of times we'll try to put the green space near a waiting room or near an elevator corridor core, so that when people come out, they see the green space and they're like, okay, as soon as I see the garden, I know that I'm back to where I need to be to get out of the building. So it can serve as a double function. This is another hospital garden. It's also a roof garden, although you wouldn't know it from looking at it because it's surrounded by buildings, but it is a roof garden. One of the things that we tried to do in this garden was actually, from the two main entries, provide a direct access to the water feature in the center, so that no matter where you come at the garden from the inside of the building, you actually see it all the time. So it's something that you want to participate in because you know it's there. And patient rooms look out on this, as well as the main hallways. The other thing is creating a variety of spaces. People, when they are go through stress, which is often the case when you're in a healing environment, different people respond to stress in different ways. Some people like to be alone, some people like to be with others. So you need to provide a variety of spaces so that people can deal with the stresses in different ways. And there are also positive distractions, which are an important function in the landscape. It could be as simple as a koi pond. It could be as simple as inviting birds and butterflies into the landscape. There's also something about water features. There's a very calming nature to water, and having that available to you is great in many ways. One of the things that we look at in design, and this was plan for the garden that you saw. It was a couple, the views from the window earlier. But we provide places where people can walk around. We provide smaller sections of the garden where people can get away if they want to be alone. We provide larger gathering spaces so that people can gather together and do activities. You also provide spaces for water feature with different types of plant material and places where that are flexible, where you can actually move around. So it's just the idea of providing as much variety in the landscape as possible. This one even had a labyrinth so that people could do a meditative experience. Some of these experiences are, water features, again, I mentioned, are great for the sound, but they're also great to touch. And so a lot of times we'll try to provide water features that you can actually not only look at and listen to, but you can actually go up and interact with. This one here at Kennedy Krieger is a ball fountain that the kids love to play with. This one here at the Kauffman Cancer Center in Upper Chesapeake in Bel Air, the fountain on the one side is something you just look at, but on the other side, there's also water coming down the back of that wall, and you're walking right past it and touch it and feel the coolness of your water. It's just a great experience for people to interact with the water. We also think about chimes. Here's something that can make a nice, pleasant sound, or it's something that you can actually use as a play activity. At the Children's Hospital in Richmond, we actually provided chimes with little mallets so kids could actually go out there and play music during the day. It's a great experience for them. And then also thinking about ways that water is just a nice, quiet little thing. This is actually a very inexpensive fountain in Upper Chesapeake in one of the smaller private gardens. And it's also a bird bath. So it's sort of a double function. It's got water, it's got sound, and it sometimes has birds. So it's kind of cool. Also, provide places for respite and healing. A lot of times that just is a place for someone to get out in the garden and sit down and feel relaxed. This woman actually, when we took the picture, she was out there in her little hospital gown, the kind that you feel like you're half naked in. And she was completely comfortable. She was like, oh yeah, take my picture. She goes, I come here all the time. She goes, she doesn't really care that she's in one of these little gowns because she's outside, she's getting a great experience. There are also and a labyrinth is a place where there's a way for someone to sort of meditatively think about as they're walking through the labyrinth. It's a great healing space. And then, of course, we've mentioned the healing of water. And sometimes it's just a place to sit in a landscape that you feel familiar with. And I think that's an important feature. And then places for walking. This can be just some place to get out and walk around the garden, but it can also be a place for exercise, meditative walking. This is again a labyrinth. It's a way to walk through a garden and think about things as you're going through. At Kaiser Permanente in Largo, they had a large suburban site. They needed to add a building to it, a garage to it, but they had this extra area where there were some native trees. They wanted to do a native landscape, and we actually did the entire landscape without lawn. So it's all native plant material. But we said, well, what if we do a walking trail? They loved the idea, and we actually were able to get a 1/4 mile walking trail around this campus. And this is that walking trail, and every time I've been out there, and weirdly there's no one in these pictures, but every time I've been out there, there's been lots of people out there walking on this walking trail, and they even provided a sign, encouraging their members to get out and experience exercise. And then seasonal interest. One of the things that it's very important in a garden that we have seasonal interest. And it's not just because of the way it looks, which is great. You do want to look out and see something that is attractive all year round. But there's also the issue of long-term care. People use seasons sometimes to help them gauge their experience. And I knew a woman who was diagnosed with cancer in the winter, and she started her treatments in the winter, and she knew that by spring her treatments would be over. So each time she looked out the window at this infusion garden, she could see that change and realize this is gauging. I'm gauging my time. I'm starting to realize that not only is it spring and things are coming out, but I'm actually getting better at the same time. So it's a great way for people to interact. And a lot of times what we'll do is we'll actually present in this case, the donor wanted to see, they were very interested in knowing how the seasonal change would happen in the garden. So we actually created a diagram for them to show them the different aspects and what would be blooming at what time of year, what would be showy at what time of year. And it's kind of a nice way to actually see for yourself as you're doing your design how you provided that experience. This is just another example of seasonal change. We also wanted to accommodate privacy concerns in any garden, and this means more than one thing. Because some of these gardens are basically found spaces, this one, for example, at Providence Hospital on the left, was the former parking lot. So there's a road that wraps right around it. We wanted to have places where people could get away and feel like they're not sitting in a parking lot. And you can do this with planting, you can do this with walls. In this case, it was a combination of planting and walls, but that actual wall is also a water feature. So it not only provides the privacy from the roadway, but it also provides sound to help buffer the roadway. So it kind of gives you several options. This other one at Kennedy Krieger is a therapy garden for children. And it's also in not downtown Baltimore, but it's in a busy section of Baltimore. It has streets on both sides that are well-traveled. And we didn't want it to feel like a walled-in garden, but we wanted to feel like there was some sense of privacy so that the kids, as they're doing their therapy, people aren't looking down at them and wondering what they're doing. So there's a sense that you're in a garden that's a nice space. And it's not built in a way that it feels like it's separating you from the outside world, because you can still see it, but it kind of gives you some sense that you're not being looked at. This also extends to patient rooms. One of the things that we find at most hospitals that I've worked with recently, our gardens are primarily on rooftops, which is a great experience, but that means that you've also got gardens that are right next to windows. And how do you deal with separating the people who are in the room that want to see the garden from the people who are in the garden that the person in the room probably doesn't want to be seen by? So we think about ways that we can provide separation between the activity zones and also the people zones. This is a concept design for a hospital in Prince George's County. But where we had the active zones, we actually provide berms that not only slant the garden up so that when you're looking out the windows, you see great views of the garden, but it also blocks the views into the patient room so that there's this feeling that I'm still in the garden when I'm in the room, but the person out in the garden isn't in my room. So it's kind of an important function. This is something that we also looked at when we were designing Mercy Hospital in downtown Baltimore. This garden is on 3 different levels, and on 2 of those levels, the patient rooms surrounded on pretty much the whole section of the garden. So where the major primary activity area is, we actually provided a trellis structure, which eventually will have, and it does now, but when this picture was taken, it didn't have vines on it, but the vines sort of filled in there, so it gives green that you're looking out onto, but it also separates you. But then we also provide a row of shrubs that sort of, as you're walking through the garden, you sort of realize, okay, I'm supposed to stop here. And that's kind of an important function as well. And then the other key to privacy is just how people like to respond to one another when they are in a healthcare facility. As I said, there are some people who need to be around others when they're stressed, and there are some who need to be alone. So sometimes providing these smaller spaces in gardens that allow you to sit together with someone and chat quietly, or allow you to sit by yourself where you feel like you're separated from someone, and even providing a small fountain in the middle to help buffer the noise so that you can actually have private conversations. It's just a way to give you that peace of mind that you are in a garden that other people are using, but you have your own private world there if you need it. Another thing that we also look at when we're designing gardens is the use of native and natural materials. Native is primarily in reference to plant material, and the reason that we do that primarily is because we're trying to be green, and we're trying to be resourceful and try to use gardens that don't require more water and more maintenance than would be necessary. Because a lot of our gardens are roof gardens, they unfortunately still do require irrigation, but we want to use less irrigation than normal. And so we try to use plants that belong in the environment. But that serves a dual function because people also respond better to plants that they are familiar with. And especially in a healthcare environment, you don't want to really startle people. Like shocking colors, shocking design changes are sometimes not the best thing in a hospital. They're great elsewhere, but maybe in a hospital they're not the best option. But also when you use natural materials, it's something that also people feel comfortable with and understand. And you can use those materials in a more contemporary way. And even native planting, we will often use native plants, but plant them in a very formal way, so they don't look like what people perceive as a native plant. They think it's a normal landscape, but it's something that's healthy and something that people understand and feel comfortable around. It's also nice to just see when you've got plant material that you're comfortable with, and this is again a stormwater facility, but it looks like a garden, and then just allowing wood and things to age naturally so that people feel comfortable. They understand that this is a process they're familiar with. And then also building things out of nature. This is again the NIH Children's Garden. This bird's nest is one of the favorite things for kids to go into. It's built out of nature. It's built to reflect nature, and it's just a great experience. Also, one thing that we think about is reasonable maintenance. The last thing you want is to do something that requires so much maintenance that they don't take care of it, and then it looks horrible and you don't enjoy being out in there. So we think about when we're designing fountains, there are cool, really crazy interactive fountains that are great for certain spaces. But in a healthcare environment where you know that they don't have a lot of money to maintain the fountains, and they're probably not going to maintain a fountain that requires 50 different jets shooting off at different times. So you try to do something that's a little bit more subdued, and something that is a little bit easier to maintain so that you know that fountain will always be a feature in the garden. And then in terms of plantings, a lot of times that means using plantings that are simplified. In Mercy Hospital, we actually use mostly native or adapted species, but we use them in large swaths. We did that for a couple of reasons. One, we wanted it to have a strong statement and connection to the building from above, but we also wanted it so that when they maintained it, if somebody was out there who didn't really know plants, they could say, well, this plant is different than all the others, so it probably doesn't belong here. And that's a way to maintain it. We also provided these bands through the garden, which you see in this picture. That was a way to tie the garden into the building and the structure of the building, so you understood how the building and garden work together. But they also served a double function. We made them 18 inches wide so that maintenance people could walk back on them to actually help to maintain the garden. And one extra benefit, which wasn't actually intentional, but what I thought was nice, I was at the hospital once and talking to a nurse who had said that they had a patient in their intensive care unit who was not able to be visited by her children. And they came and were out in the garden while the father was in with their mother. And someone said, well, you know what, you can probably walk down those granite bands and get your mother's window. So they were actually to look in the window, and this was a case where we felt good about someone getting to the window and looking in, because they were able to actually see their mother. She was able to see them. It was a great experience for everybody. And then I think the idea of found space. As I mentioned before, a lot of hospitals really didn't think about green space until recently, and so many of them have not really had adequate spaces, and a lot of new hospitals, particularly in urban areas, take the whole site. Basically, the footprint of the building is the entire block. So where do you find space for gardens? And a lot of times that's a roof garden. We've done several roof gardens throughout the region, and those are really great spaces. One of the things, I think you've seen the Mercy Hospital before, but the one on the right is actually an infusion garden at Upper Chesapeake's Kaufman Cancer Center. And that garden is actually just outside of the infusion center, so that people are usually looking through the windows at the garden as they're getting their treatments. But what they found is that a lot of patients said, you know what, I want to have my treatment in the garden. So when the weather's nice, the nurses will actually take them out there with their drip, and they'll actually sit in the garden as they're having their treatment. And I thought that's really a great way to use a garden. And one other thing that's notable about that is you see trees in the background, and it's the idea of being able to borrow green from elsewhere. That's not even on the hospital property, but there was a wooded area beyond there, And if you place gardens in the right location or windows in the right location, you can actually borrow green from someone else. And I think that's a nice feature to have. This is an example of borrowed space at grade. The Sisters at Mercy wanted to have a monument to all of the heads of the hospital over the time since the hospital had started in the 1800s. And they want it to be outside, but because this hospital fills the entire lot, there was only one space where there was any green space, and this is over structure, by the way, but it's also an entrance to the drop-off, and it was a 9-foot drop from one corner to the other. And they wanted to have a plaza, and you're like, wow, how do you do that? So we actually found space on this area by providing a little platform area and then a garden around it. And it actually served the double function of providing them a space to have this memorial, but it also blocked views from the street into this, it's not really the service entry, but it's kind of the service drive into the hospital. So it can serve a double function and provide a nice experience that otherwise might not have been there. And I think I mentioned also previously about the Providence Hospital garden in the parking lot. So there are lots of different ways that you can find space that you might not otherwise think is available to you. And then the last thing I think is really thinking about your spaces as flexible. What can I do with these gardens other than just have them be pretty? Because being pretty is important, but they also need to serve a function. And you know, this garden at Kennedy Krieger, when you're looking out at it when there's nobody in it, it seems like just a nice little garden. It's got a fountain, but the fountain was actually placed at a height that someone in a wheelchair could reach in and touch the water. The grass was actually used in different ways and different slopes so that people who were learning to walk again can get out and walk on different surfaces. The pavement is different types of pavement and different surfaces so that you can learn to walk on different types of pavement, learn to use your wheelchair on different types of pavement. So there are functions that can be used it's not only part of the design, but it's how it's also used. The parking lot garden at Providence Hospital in Washington, D.C., they actually use that lawn space for Tai Chi in the mornings. They have lunchtime concerts, and they have lectures in the afternoons. So they use it over and over and over again. And they do the same thing at Upper Chesapeake. It's a nice way to use these areas for different ways. This is again Kennedy Krieger, but this same lawn space that was used for therapy is also used to play games, and it's just used as a place to hang out. So it's a nice experience. One of the other things about flexibility is because people react differently, and if you have a different size garden, smaller garden, you need to have options for people to be able to integrate with one another in different ways. So if you provide places for seating, it's good to have fixed seating that people can sit on where they understand where it is, but it's also good to have movable seating that people can move around and configure in the way that they want. And so we try to do that in every garden where we can. One other thing that we do is in roof gardens, you're often having to use walls to raise the soil level so you can actually plant the trees. So why not make that a seat wall? So it serves a double function. It's just a nice way to have a more flexible environment. Again, I mentioned the movable chairs before, but at the healing garden, the infusion garden at the Kaufman Cancer Center, the wall is there to provide soil depth, but it's also has seating with a back, it's got seating without a back, and it's got flexible seating. It's got every option you could possibly have. So you try to think about different ways that you can be as flexible as possible. Kaiser Permanente, they're very interested in the health of their patients and not just treating them while they're ill, but trying to keep them well. And one of the things that they do is 2 times a week, they have a farmer's garden at their healthcare facility so that people can come in and get fresh produce, and they also have classes to teach them how to use fresh produce. So they wanted us to provide a space for a farmer's market, which is great, and they do this all the time, and I've even bought my own produce there and taken it home with me. So it's a good experience. So I think it's just the idea of having gardens that are available and flexible and meet the needs of the patients. That's it. Thank you.
Before concluding this event, I would like to thank our speakers and all of you for joining us. We are planning to have similar events in fall and spring. So hopefully we will see you very soon. Thank you.